Picture this. It's 3 in the morning.
Oh, the worst time to wake.
You are dead asleep, enjoying a perfectly good dream, and suddenly you are just jolted awake by this intense, completely maddening sensation.
Let me guess. An itch.
An itch. But it's not on your arm or your shoulder or your back. It is deep, deep inside your ear canal.
Oh, yeah. The unreachable one.
Exactly. It feels completely unreachable. So you try the classic pinky finger jiggle, right? You roll over, you try to ignore it, but it just will not stop.
Yeah, it drives you absolutely crazy.
It really does. And your first thought is usually, I don't know, great, a mosquito somehow got into my ear. Or maybe you assume it's some bizarre seasonal allergy flaring up because the pollen count is high.
That's what almost everyone assumes, yeah.
But what if I told you that middle of the night ear itch has absolutely nothing to do with bugs or pollen or dust? What if it is actually driven by a massive systemic shift in your reproductive hormones?
It sounds almost like a medical prank when you phrase it that way.
It really does.
But it is an incredibly common physiological event. Yet it's something almost no one talks about. I mean, women just suffer in silence thinking they suddenly have terrible hygiene or, like you said, late-onset allergies.
Which is exactly why we are dedicating this deep dive to answering a very specific, somewhat mind-bending question. Can the hormonal shifts of perimenopause and menopause actually impact the production of earwax, leading to severe blockages or that maddening itching?
It's a great question.
And today, we are looking at a stack of really fascinating sources to figure this out. We've got clinical guidelines from the NHS and the Mayo Clinic. We have insights from menopause specialists like Dr. Jolene Brighton and Dr. Sonia Dudeja, and audiology research from Trouble Health and Tinnitus UK.
It's a really diverse set of data. I mean, we're crossing over endocrinology, dermatology, and audiology here.
All at once.
Right. And our mission today is to synthesize all of this, to uncover the hidden biological connection between dropping estrogen and the physical health of our ear canals.
Okay, let's unpack this, because I have to ask, how on earth does a reproductive hormone have any business affecting the inside of my ear? I mean, we usually just think of estrogen in terms of, periods, pregnancy, and hot flashes.
Well, to answer that, we have to fundamentally shift how we view the body.
Okay.
We tend to look at ourselves as a collection of isolated parts, right?
Yeah.
The reproductive system is over here, the auditory system is over there.
Right, totally separate boxes.
Exactly. But if you were sitting here with me, you'd see my backdrop has conceptually shifted to this intricate, highly detailed anatomical diagram of the inner ear. And threaded through all of that delicate auditory architecture is this glowing network representing the endocrine system.
The hormonal system.
Yes. They're deeply structurally intertwined.
Because the inside of the ear isn't just like an empty plastic tube. There's actual living tissue in there that needs to be maintained.
Precisely. There's a highly specialized layer of very thin skin, mucous membranes, and sebaceous glands lining that canal. And maintaining all of that delicate architecture requires a master regulator.
And that regulator is estrogen.
That's the one. We label it a reproductive hormone, sure, but estrogen is actually a systemic moisturizer for your entire body.
A systemic moisturizer. I like that.
Yeah. It is responsible for stimulating the production of natural oils, sebum, as well as hyaluronic acid and collagen across all your tissues, literally from your scalp to your toes.
So if I'm visualizing this, estrogen is essentially the mortar in a brick wall.
Oh, that's a good analogy.
Right. It's holding all the individual skin cells together, keeping them plump, and keeping the whole structure resilient and weatherproof so things can function smoothly.
That's a perfect way to look at it. Estrogen provides the structural integrity. But during perimenopause and menopause, as those estrogen levels naturally start to fluctuate and eventually plummet, that mortar begins to dry out and crumble.
Oh, wow.
Yeah. The collagen breaks down, the natural oil production just drops off a cliff.
And so the brick wall, the skin inside the ear, becomes brittle, it becomes fragile and exposed to the elements.
Exactly. And the clinical term for what happens next is transepidermal water loss.
Transepidermal meaning like through the skin.
Right, cross the skin barrier.
Yeah.
Because the skin has lost its protective oily barrier, it literally cannot hold on to water anymore. The moisture just evaporates right out of the tissue into the surrounding air.
And if we connect this to the bigger picture, you realize this isn't an isolated event happening exclusively in the ear. That same loss of the mortar is happening systemically everywhere in the body.
Which is the key to understanding menopause entirely. I mean, it's why women in this stage of life often experience severely dry eyes or burning mouth syndrome where their tongue feels like they've been, sucking on a metallic penny.
Oh, that sounds awful.
It is, and it's the exact same mechanism that causes vaginal atrophy and pelvic dryness. It's all the same estrogen-dependent mucosal tissue, just located in different parts of the body.
They all rely on that same master moisturizer.
They absolutely do.
Well, that actually brings up something that seems like a total contradiction in the clinical research. Let's call it the earwax paradox.
I like the sound of that.
Because if my ear canal is drying out from a lack of oil and moisture, it logically seems like I would have less earwax, right? I should have a totally dry, empty ear.
That would make sense intuitively.
Right. So why do the clinical guidelines from the NHS and the Mayo Clinic highlight that menopausal women often suffer from severe, sudden earwax blockages?
You're hitting on the core paradox there. And to solve it, we need to clearly define what earwax or cerumen, clinically speaking, actually is.
Okay, what is it?
Well, people often think of it as just dirt or buildup that needs to be scrubbed away.
Right, like a hygiene issue.
Exactly, but it's not. It is a highly specialized protective mixture. It's made of sebum from your oil glands, shed skin cells, and sweat.
Because it serves a very specific evolutionary purpose, right? It repels water, it traps dust and debris before they can reach the eardrum, and it even maintains this slightly acidic environment to keep fungal and bacterial infections at bay.
Right? It's essentially a self-cleaning mechanism.
That's amazing.
It really is. And in a healthy, high estrogen state, that wax does its job beautifully. It is soft, lubricating, and it naturally migrates out of the ear on its own, carrying debris with it.
Okay.
But during menopause, as that normal, healthy, lubricating wax diminishes, because remember, the oil factories have shut down, the body panics.
Wait, the body panics? It just starts mass-producing wax out of fear?
In a sense, yes.
Yeah.
The body recognizes that this vital protective barrier is vanishing, so the sebaceous glands overcompensate. They try to produce more wax to protect the naked skin,
Oh, I see.
but because they lack the proper moisture and oils, they produce a highly altered type of wax. It's dry, it's hard, and it's flaky.
Wait, I'm still stuck on the mechanics here, though.
Yeah.
If my body is producing less oil, how can I suddenly have an excess buildup of wax completely blocking my hearing? Like, a dry, flaky pellet doesn't sound like enough volume to cause deafness.
Well, because the issue isn't necessarily the volume of the wax, it's the consistency of the wax, combined with the hostile environment it's now sitting in.
Okay, walk me through that.
Think back to that crumbling brick wall analogy. You now have this hard, dry pellet of wax sitting inside an ear canal where the skin is tissue paper thin, incredibly dry, and severely lacking elasticity.
Oh, so it can't move.
Exactly.
Right.
The wax simply cannot slide out naturally. There's no lubrication to carry it. So it gets stuck, it piles up, and eventually it impacts heavily against the eardrum.
Okay, I see it now. And that impaction leads to the physical blockage. You know, the feeling of pressure, the muffled hearing, feeling like you're permanently underwater.
Yes. And beyond the hearing loss, the impaction itself causes immense physical irritation to that already fragile, brittle skin. It triggers an intense, unyielding itch cycle just by sitting there.
Man. Okay, so I understand the physical blockage now. The skin is thin and the wax is stuck. But a physical blockage doesn't explain some of the more bizarre sensations women describe in these sources?
No, it doesn't.
I mean, the physical changes are one thing, but women are reporting intense things, like the feeling of bugs crawling around inside their ear or a sudden deafening ringing. How does a lack of oil cause a hallucination like that?
Let's tackle the crawling sensation first, because it is terrifying for the people experiencing it.
Okay, right.
There's a specific medical term for this, actually. It's called formication, spelled with an M.
Formication. Okay.
Right. And it is a sensory misfire of the nervous system.
So it's an electrical problem, not a physical bug.
Exactly. The skin inside the ear canal is packed with highly sensitive nerve endings. Ordinarily, they are cushioned by collagen and fat. But as the skin thins out and loses that collagen padding, those nerves become hyper-exposed and hyper-excitable.
Oh, so they're just raw.
Yes. Furthermore, the wildly fluctuating hormone levels alter how the nerves send signals to the brain. So your brain interprets this chaotic, misfiring static from the exposed nerves as the physical sensation of insects walking on or just under your skin.
That is deeply unsettling.
Very much so.
But also, incredibly validating to know it's a documented physiological event. It's not someone just losing their mind.
Absolutely.
And the sources also point out a connection between this itching and histamines. The whole suddenly allergic to everything feeling that hits women in their late 40s.
Yeah, what's fascinating here is the incredibly complex, almost antagonistic relationship between estrogen and histamine.
Okay.
When estrogen levels spike and crash during perimenopause, like a biochemical roller coaster, those spikes stimulate your mast cells. Mast cells are your immune cells, and when stimulated by estrogen, they release massive amounts of histamine into your bloodstream.
Histamine being the chemical culprit that makes you turn red, itchy, and swollen when you have a normal allergic reaction to pollen or a bee sting.
Right. It's the primary inflammatory chemical, but
Yeah.
it's even more chaotic than just releasing histamine.
How could it be worse?
Well, at the exact same time estrogen is triggering that release, those hormonal fluctuations are also actively disrupting a crucial enzyme in your gut called DAO. Yes, the DAO enzyme's entire job in the human body is to act as a cellular sponge, breaking down and clearing out excess histamine from your system.
Wait, slow down. So estrogen fluctuations are simultaneously triggering the massive release of histamine A and D, firing the cleanup crew that's supposed to get rid of it.
That is a brilliant summary of the process, yes.
That sounds like a recipe for a total immune system meltdown.
It basically is. Your histamine bucket fills up rapidly, and there is no drain at the bottom. This creates a systemic histamine overload. For the years, this translates to a constant, maddening, prickly heat sensation.
Wow.
And this is why diet suddenly becomes a factor. A glass of red wine, or a piece of aged cheese, or fermented foods, which all contain extremely high levels of naturally occurring histamines, can suddenly make your ears burn and itch uncontrollably, even if you've eaten those foods your whole life without issue.
That is wild. And then there's the ring, tinnitus. I mean, it feels like everyone knows someone who suddenly developed tinnitus in midlife.
Yeah.
How does that fit into this whole hormonal puzzle?
Tinnitus is deeply tied to the earwax impaction we talked about earlier.
Oh, the hard wax.
Right. When you have a hard, stubborn block of dry wax plugging the canal, it physically blocks external sounds from the room from reaching your eardrum. The acoustic pathway is jammed.
So the outside world gets quieter, sure, but that doesn't explain why the inside of your head gets louder.
Well, because your eardrum and your auditory nerve aren't distracted by ambient noise anymore, the brain actually turns up its internal microphone.
Really?
Yeah. It amplifies internal sounds to compensate for the lack of external input. So the baseline electrical noise of your auditory system, the rushing of your blood through your vascular system, all of that is suddenly amplified and becomes deafeningly loud.
That is fascinating.
That is why simply clearing the impacted menopausal wax often makes the severe tinnitus magically disappear.
So what does this all mean for the listener? I mean, if you wake up at 3 a.m. with an itchy, ringing ear, how do you know it's menopause and not just a standard run-of-the-mill ear infection? Because nobody wants to ignore an infection and risk permanent damage.
Oh, absolutely. That is a vital distinction, and the clinical guidelines provide very clear differential diagnosis markers.
Okay, what are we looking for?
A hormonal hitch is generally a dry, persistent tickle. There's no fluid discharge, or maybe just a tiny bit of dry flakiness. And, crucially, your hearing is normal, unless it happens to be physically blocked by a chunk of that hard wax.
Whereas a bacterial or fungal infection...
Infection is highly aggressive. You will experience throbbing pain, severe pressure, and almost always a wet, foul-smelling yellow or green discharge.
Yikes.
Yeah. You might also spike a fever or have swollen lymph nodes in your neck. If you have those symptoms, you need an urgent appointment with a doctor for antibiotics, not an estrogen supplement.
Okay, so let's assume we've ruled out the infection. We know it's hormonal. We know we are dealing with dry skin, hypersensitive nerves, histamine overload, and maybe some stubborn hard wax.
Right.
This brings us to the most practical part of this deep dive. Because knowing all the biology in the world doesn't stop the immediate primal human instinct. When something itches, you want to scratch it.
Which, according to every audiologist and dermatologist in our sources, is the absolute worst thing you can do in this specific scenario.
It is the Q-tip trap.
Yes, the Q-tip trap.
We read through dozens of severe warnings in the NHS guidelines about this. Why is sticking a cotton swab or a bobby pin or a paper clip or even just aggressively doing the pinky finger jiggle so dangerous for a menopausal ear? Why can't we just scratch the itch?
It goes all the way back to the lack of collagen we discussed at the start. Menopausal ear skin is profoundly compromised. It is no longer plump and resilient, It is paper thin and highly vulnerable.
So think about taking rough, dry sandpaper to a piece of delicate, wet tissue paper.
Oh, man.
That is what the woven cotton of a swab feels like to this specific tissue.
That's a very accurate, if slightly horrifying visual.
Hmm.
When you introduce a swab or a fingernail into that environment, you aren't fixing the underlying itch because the itch is neurological and hormonal. Instead, you are actively destroying the lining. You cause micro tears in the tissue.
Which rips open the skin barrier and basically rolls out the red carpet for bacteria.
Exactly. You turn a relatively harmless hormonal dry skin issue into a full-blown, painful bacterial infection. Furthermore, if there's dry, impacted wax in there, a swab will just act like a ramrod.
Right, pushing it.
It doesn't pull the wax out. It pushes the hard wax deeper against the eardrum, compacting it further, risking a ruptured eardrum and severely worsening the tinnitus and hearing loss.
And while we are talking about what not to do, we need to explicitly debunk a trend that pops up on social media all the time as a natural remedy for earwax. Hopi ear candling.
Oh, goodness.
The idea where you lie on your side and light a hollow fabric candle in your ear to somehow vacuum out the wax using heat.
The clinical consensus from audiology experts on ear candling is unanimous and absolute. Do not do it. It is entirely pseudoscience.
But people swear they see the wax getting pulled up into the candle.
I know, but it creates zero vacuum pressure. Physics simply does not support it. The dark debris people see inside the candle afterward is just the melted residue of the beeswax and fabric of the candle itself burning.
So it's just a trick.
It is. And more importantly, it poses a severe, documented risk of burns to the face, hot wax dropping onto and puncturing the eardrum, and permanent hearing damage.
Oh.
We really have to encourage critical thinking regarding consumer trends here. Just because a product is sold over the counter at a pharmacy, whether it's an ear candle or an aggressive peroxide-based wax removal drop, does not mean it is safe. Harsh peroxides will strip whatever remaining moisture is left in hormonally compromised, paper-thin skin.
Okay, so we're permanently putting down the cotton swabs, we're throwing away the ear candles and the harsh peroxide drops.
Please do.
But people are still suffering at 3 a.m. If we absolutely cannot scratch, swab, or candle our ears, well, what are the actual clinically backed methods to find relief?
The good news is there are highly effective, gentle interventions. We can divide them into at-home care, mechanical medical procedures, and hormonal treatments.
Let's start with what people can do tonight, at home.
For at-home care, the goal is manually replacing the moisture that estrogen is no longer providing. You can use 1 to 2 drops of plain, room-temperature olive oil or mineral oil applied just to the outer edge of the ear canal.
Oh, just normal olive oil.
Yep. This acts as a gentle external lubricant to soothe the exposed nerves and soften any hard wax so it can naturally migrate.
And environmental moisture matters too, right? If the air in your house is dry, it's just accelerating that transepidermal water loss.
Absolutely. Sleeping with a humidifier in your bedroom is a fantastic passive intervention. It helps all your mucous membranes, your dry eyes, your burning mouth, and your itchy ears retain moisture overnight while you sleep.
I also loved the behavioral tip from the Gen M report about cotton gloves.
Well, that's a great one.
Yeah, if you are someone who unconsciously scratches your ears in your sleep, wearing soft cotton gloves to bed physically prevents your jagged fingernails from causing those micro tears we talked about.
It's a very practical, low-tech solution to break the itch-scratch cycle. And nutritionally, increasing your dietary intake of omega-3 fatty acids and vitamin C is heavily recommended by the dermatology sources.
How does that help?
Well, vitamin C is vital for your body to synthesize whatever collagen you are still capable of producing. And omega-3s help physically rebuild the lipid barrier of the skin, keeping the moisture locked in.
Okay, but what if the at-home oil drops aren't cutting it, and you already have a solid, painful blockage of that hard menopausal wax?
Then you need a medical intervention to remove the physical barrier. But again, you have to advocate for the right specific treatment. You want to see an audiology professional for a procedure called microsuction.
That's the tiny, high-tech vacuum.
Yes, it's a highly precise, liquid-free vacuum technique performed under a specialized microscope. It allows the clinician to safely lift the hard wax completely off the delicate skin without scraping the walls of the canal.
And what if that isn't available?
Electronic irrigation, which uses a controlled, gentle, temperature-regulated pulse of water, is another safe option if microsuction isn't available.
But the old-school manual syringing, where a nurse just blasts warm water into your ear with a giant metal syringe, that's a big no for menopausal women.
A huge no. The NHS guidelines actively advise against manual syringing now. The pressure is uncontrolled, and the risk of eardrum perforation and severe acoustic trauma is simply too high, especially when the skin in the canal is already fragile and thin.
Which brings us to the final tier of relief, treating the root cause rather than just managing the symptoms, the hormones themselves.
Right. For many women, hormone replacement therapy, or HRT, is the ultimate off switch for these bizarre symptoms. By systemically replacing the estrogen, you restore the moisture, the collagen padding, and the natural oil production across the whole body.
So everything just turns back on.
It does. The formication, that hallucination of crawling bugs, often resolves completely once the nerves are cushioned again.
But HRT isn't an option for everyone, whether due to a history of breast cancer, blood clots, or, other personal medical reasons. And here's where it gets really interesting. I want to talk about the localized approach.
Ah, you're referring to the topical estriol protocols mentioned by the menopause specialists?
Yes. Several of the specialists in our sources noted an incredible workaround. Doctors will sometimes prescribe a tiny amount of topical estriol, which is a very weak estrogen commonly prescribed as a vaginal estrogen cream to treat pelvic dryness, and recommend applying a pea-sized amount to the outside opening of the ear canal a few times a week.
It really highlights the incredible universality of the human body's design. The estrogen receptors in your ear canal behave almost identically to the estrogen receptors in your pelvic region.
Wait, really?
Yes, they're the same type of tissue.
Well,
By applying the hormone locally just to the ear, you can wake those specific receptors up, signaling the tissue to plump up, hold water, and produce oil again without necessarily needing to absorb high levels of estrogen systemically through your whole bloodstream.
it just blows my mind that the exact same cream a woman might use to treat vaginal atrophy can completely cure a ringing, itchy ear. It perfectly illustrates your point from the beginning of the show. The body is a deeply interconnected web.
It is a brilliant example of how understanding and treating the underlying biological mechanism is so much more effective and often simpler than just chasing an endless list of individual symptoms.
So to bring this all together for you listening, if you have been secretly sticking your pinky in your ear, wondering why your allergies are suddenly out of control in your 40s or 50s, or why you suddenly have a wax impaction for the first time in your life, you are not crazy.
You're really not.
It is not a bug. It is not a sudden lack of hygiene. It is a profound systemic biological shift.
Your body is navigating a massive transition. The drop in estrogen is physically altering the landscape of your skin, shutting down your oil production, throwing your histamine clearance into chaos, and leaving your delicate auditory nerves exposed.
But understanding why it happens is what gives you the power to handle it. You don't have to suffer in silence. You don't have to give up your favorite HGs without knowing why it makes your ears burn. And you definitely don't have to damage your hearing by going digging with a cotton swab.
Please don't.
You can treat the tissue gently, moisturize it safely, and talk to a doctor about localized or systemic hormonal support.
Knowledge really is the best intervention here. When you know the mechanisms, you can protect the architecture.
Absolutely. And as we wrap up, I want to leave you with a final thought to really chew on. We've just spent this deep dive exploring how estrogen levels physically alter the skin, the wax, and the nerve sensitivity of our ear canals. We even talked about how those physical changes can shift our tolerance for high-pitched noises and trigger roaring tinnitus by changing how sound physically enters our head.
The hormonal influence on the auditory system is profound, and we are only just beginning to map the full extent of it.
So if our ears, our literal instruments for receiving sound, are this deeply physically sensitive to our endocrine system, well, it raises a really wild question. Does the actual soundscape of the world physically sound different to us at different hormonal stages of our entire lifespan?
Wow.
Right? Do the frequencies of music we find soothing in our 20s literally grate on our nerves in our 50s, not because our taste in music matured, but because the biological acoustic chamber of our ear has physically transformed?
This raises an important question about how much of our perceived reality is just a byproduct of our current hormonal state. That's a fascinating concept.
Think about that the next time you wake up at 3 a.m. with that unreachable itch. It's not just an annoyance, it's your body actively tuning its instruments to a brand new frequency. Thanks for diving deep with us today.